Well, welcome back to the Clinic Efficiency Podcast. I'm Donald Weeks, founder and CEO of ClearPath AI. And today I'm joined by David Pachkofsky, the founder and chairman of the board of Dapper, a physician support platform built around single conviction that most patients don't fail treatment. The system fails patients. David started his first company at 15 and had his first exit before he turned 21. Over the past 2 decades, he's built 16 companies, primarily in the health and wellness sector. After losing his brother to brain cancer, he shifted his focus away from business-driven entrepreneurship and toward mission-driven work, specifically extending people's health span and improving outcomes at scale. Dapper is a result of that pivot. David, welcome to the show.
Thanks for having me. I appreciate it.
Yeah. Well, David, you've built 16 companies over 2 decades, most of them in health and wellness, but at some point, something shifted in you. It wasn't just about building the next business. Can you walk me through what that transition looked like and what losing your brother had to do with the direction you've taken with Dapper?
Sure. So Dapper was born from both experience and personal loss. So after building businesses in health and wellness for years, I had the front row seat on how difficult healthcare can be for patients. And then I lost my brother Adam to brain cancer 2 years ago. He would be 41 today. So he was young. That experience changed everything for me. And it forced me to think about healthcare differently. I began asking why wait until people are sick before intervening, why patients navigate such fragmented systems on their own. And the experience changed everything for me. It forced me to think about healthcare differently. And I began asking why. I'm sorry, I just spaced out.
That's all right. Oh, yeah, that's okay.
Yeah. So I began asking myself why wait until people are sick before intervening and why patients are left navigating this fragmented system on their own. Dapper became my answer to those questions. Our mission is to help physicians deliver better outcomes and help patients get the support they need throughout their healthcare journey. So I had always built companies that sold products and services that I felt people needed, but the products and services weren't always, a lot of them were in the nutraceutical space, unregulated market, not FDA approved. They still did, had, therapeutic value and, and help people. But I sold nearly $1 billion in these products over the last 25 years. And I just didn't feel that I was moving the needle. And that's why with the loss of my brother, it had a direct impact on me. And I wanted to do something different. I wanted to actually impact people's lives and help them not extend their lifespan, but extend their health span. Because life it's not about, when you're 80 or even 70, people, you ask them, well, do you want to extend if you could extend your life another 20 years, would you? And most of them aren't interested. I was talking to my parents about this over Christmas, and I mean, they're in their late 70s and they're, in good health, but they're, you have aches and pains and everything. And with the loss of their son, it makes it a little bit more difficult. So they're an exception, but they said, my mom's like, I'm not sure I would, if I could, but if you could actually roll the years back and actually, when you're in your prime and you're still feeling good, when you actually can enjoy your family and you can travel, enjoy life, and it's all about the experiences, right? And you could actually expand your health span and give yourself more of the good years, then that makes a big difference. And so that's what Dapper focuses on.
Yeah, that's good. Well, let's talk about what's actually broken. You've described healthcare as reactive rather than proactive, a system where patients get a prescription and then largely disappear until something goes wrong again. From your vantage point, as someone who's worked across 16 health and wellness businesses, what's the most damaging gap in how healthcare is delivered today?
Where do I start? Well, let's see here. What's broken in healthcare today is the biggest thing that I think that Dapper's addressing is the problem with fragmentation. So, and I read about it every single day. I was just before this podcast, I was reading an article about the VA actually rolling out its new EHR to all, multiple locations. And they were saying that even today, there's still multiple systems set up and everything is siloed and nothing communicates with each other. And so the workflows are all broken. And then that's why what's broken here. So healthcare has incredible doctors, incredible technology, and incredible treatments. And what lacks is the coordination and everything speaking to each other, right? And I can, just an example, like nowadays, your smart wearable device, your Apple Watch, knows more about, your heart and your health than your doctor does, right? It's unfortunate because these things aren't connected to each other. Patients bounce between providers, pharmacies, labs, specialists, insurance companies, health systems, and nobody owns the entire patient journey. That's the biggest problem. So the result is delayed treatment, poor adherence, missed follow up, and preventable complications. So the issue isn't the lack of innovation, it's that too many pieces of the system operate independently. So basically, that's what we're doing. We're connecting all these things together. So by providing Dapper's platform allows a doctor. I guess I can give you just the what Dapper does, so that everybody
Sure.
knows, and it
Sure.
makes a little more sense here. So I don't want to jump ahead. So what we did, Dapper, to address this siloed problem, this fragmentation, is we built a platform that combines an EMR, pharmacy ordering, patient support, diagnostic testing, and follow-up care. So that the silos, the EMR, the compounding pharmacies, delivery and logistics, and the patient support that were all siloed before now are all combined into one system. So Dapper provides a unified AI-driven platform that makes proactive care simple to deliver at scale. So essentially, we partner with physicians and give them the operational layer to provide the telehealth level experience that patients expect by still keeping them in the middle or in the center of everything. So telehealth companies are cost effective. They're convenient, but they're making physicians back office workers. They're taking an AI first approach and AI is instrumental and it's critical, that we use it, but it's not there yet. It's not at that point where people can rely on it and replace people. Maybe someday, probably down the road, hopefully not, but the but AI will get to the point where it's good enough to, be able to handle these things. So we built a platform that AI supports the physicians and the patients, but doesn't replace them. And then on top of it, we built this AI integration that extracts data from the prescriptions, the lab diagnostics, hotspots, new like referral and follow-up revenue opportunities for the physicians. And it's an efficient AI run channel modules that dictate best care practices for the physicians. So physician feedback, patient response data, adherence data, aggregated treatment data, and healthcare information. So essentially, everything's communicating with each other now. So a patient either sees the doctor in person or via telehealth, whatever they do. And we focus on cash pay, longevity focused treatments. So right now we're focusing on men's sexual health, so erectile dysfunction, hormone replacement therapy, testosterone treatments, and weight loss. So the GLP-1, in GLP-2, GLP-3, so semaglutide, tirzepatide, retatrutide, these kind of things. And then we do female sexual health and hormone replacement therapy too. So estrogen, testosterone, progesterone, all these things. So, and these are treatments that typically are not covered by insurance. They're very expensive to go through, like get what Ozempic or Wegovy that everybody's heard of, pay $1,800 for these things, and they're not covered by insurance typically. We compound the medication. It's identical, and our cost is between $150 and $300. So get it cost effective, accessible to everybody, and then we support them. So it's not like you're shopping at Amazon and like most of these telehealth companies are, where you just order your meds and they ship them to you, and then you're kind of on your own. Instead, we
Right.
actually support them throughout with our AI health companion,
Right.
and you know, and we have 24/7 care support post prescription, so patients don't fall through the crack. So
Yeah. Well, let me kind of summarize. I guess
yeah,
what you were saying there is Dapper is built around the moment most healthcare platforms ignore entirely after the prescription is written, and you handle the fulfillment at the lowest cost, patient education, adherence tracking, automated refills, and ongoing support. So, why is the post prescription window so critical, and why has the industry done such a poor job of owning it?
yeah. I think the problem is that everything up till this point has been focused on healthcare 1.0, and
Hmm.
we're making this transition, or helping physicians make this transition to healthcare 3.0, which is moving from sick care to proactive care. And I use the concept of an example of your car. You have scheduled tune-ups, right? You have a dashboard. You can see what's going on with it when the lights go on, when it's low on gas, when it needs oil change. You bring it in and have that done. And the whole purpose of that, and you bring it in for scheduled tune-ups, is so that you don't blow the engine, right? So that
Right.
you don't
That's right.
have catastrophic failure down the road. It's about regular maintenance on a regular basis so that you're avoiding costly mistakes that are sometimes you can't fix them. So, and it should be like that for your body too. And it hasn't been up till now, because the way that things, like physicians up till now, the way that they approach things is they treat the symptoms. So, they look at the symptoms, and based off of that, they treat each symptom and what it's related to. Right. But unfortunately, there's a lot of things like cancer that are preventable, but there's no symptoms. And that's why, like, you know, uh, you've got men. I mean, well, for women, breast cancer, for instance. There's no real symptoms with breast cancer except for a lump.
Right. Right.
Same with men. It's like prostate cancer, and all these, and colon cancer, and penile cancer, and all these things that are really common, but people don't find out that they have until it's too late. And so, well, we're taking this longevity approach, where we actually provide these different treatments that move the needle, and allow Dapper's platform to give you a snapshot at any given time how things are progressing. If you make a change in your diet or your sleep, or add a medication, or stop taking a medication, and our platform will make recommendations to adjust things, so that, because things aren't siloed with ours, you have at home blood diagnostic testing that the doctors can order up to 130 biomarkers, and you take that, all that information from those tests are populated into your dashboard within 72 hours for the doctor and yourself. And then AI makes a summary of it and only flags the things that are, requiring follow up. So, and then it takes that data and it combines it with everything else that's from your smart wearable device and the other treatments that you're taking. And then you can look at the dashboard and you can see, if, rather than looking at all these crazy numbers that you have no idea what's going on, it's just simple. Are you in the green or are you in the red, basically?
Right.
Yeah. So that's the
Yeah. That's
idea, at
good.
least. So
Yeah. Yeah, that's leading, I guess, to my next question was, I know you've talked about the early detection and preventive medicine as the area where you think the biggest breakthroughs are coming. For physicians who are currently focused almost entirely on reactive care, treating what's in front of them today, what would it take operationally and culturally to shift towards a more proactive model? I mean, where does Dapper fit into that shift?
so I guess, let's see. I can talk about like some of the trends, I guess, in healthcare, and what I'm most excited about, I
Sure.
guess. So
Yeah.
there's three that stand out, And first one is early detection. So the ability to identify disease years before symptoms appear could transform healthcare. End of subject, end of story. So we're going to be offering one of it's the first FDA approved HPV test at home diagnostic testing coming up this year. Is a early detection for several different types of cancer and females that are typically have, no symptoms. And so you don't know until it's too late. So, which leads back to, what we were just talking about. So this could be, you know, have such a huge impact on people because for the longest time, well, they didn't realize that 80 to 90% of adults will contract HPV by the time they die or at the end of their life. So, but there's certain types of it that cause cancer or directly related to it. And they weren't testing for it before. And so there's a lot of people that that you hear, like, for instance, I was talking to my good friend that's a radiologist. I was talking about my grandfather, and now it's unfortunate. He's a really big impact on my life, but he died early on of throat cancer. And he said, well, he probably died of HPV, essentially. So,
Right.
but they just didn't even test for it back then. So anyway, so that's the first one. The second one is personalized medicine. So we're moving away from generalized treatment plans and towards care that is tailored for individual biology and health data. So, like healthcare isn't about one size fits all. It shouldn't be, but it has been up till now, right? How one, a medication reacts to a 100-pound female is going to have a different impact, effect on a 300-pound linebacker, right? So,
That's right.
But the economics have steered healthcare in a different direction, and for that reason, that's why it's everything's been produced, as just a standardized, you know, medications. But we're changing that. So. And then the third one is AI-driven decision support. So physicians will have access to tools that will help them make faster and more informed clinical decisions. So, and then, combined, all of these three trends are potentially the dramatically improved outcomes. So,
Yeah, absolutely. Well, that sounds great. I mean, last question I have is, and I want to make it both personal and practical. I know you've built 16 companies and had multiple exits. You lost a brother and redirected your career around a mission. For the practice owners and clinic operators in our audience who are running businesses and trying to do right by their patients at the same time, what's the one thing you want them to carry into their work after this conversation?
yeah. So it's, yeah. So the advice is that focus on solving real problems. Okay. Too many founders start with an idea and look for a problem. The companies that start with a problem and build the solution around it are the ones that succeed. Okay. So that's the big one. And second is develop resilience. Every entrepreneur faces setbacks, rejection, and uncertainty, and the odds are stacked against you. You're really, sometimes I have to have check my head to see why I actually, keep doing this, because it's really, but if it wasn't for people like us, this world, wouldn't be where we are today. So the most important thing here is to stay humble enough to recognize your strengths and weaknesses. Self-awareness is one of the most underrated skills in business. Okay. And stop thinking that you can do everything yourself, and have the realization that I always say, if you're the smartest person in the room, you're hanging out with the wrong people. I built this amazing company not because I'm a genius. It's because I have the know-how and the ability to find people, the right people, that do things that I'm not good at, or that I lack in certain skills, and and get them to help you out. So you can't do everything yourself. So that's my advice.
Yeah, absolutely. Well, David, this has been exactly the kind of conversation I was hoping it would be. honest and mission driven, and genuinely, I think, useful for anyone trying to build a practice that actually serves patients over the long term. Thank you for your time and what you're building with Dapper.
Thank you. Appreciate it. Thanks for having me.